If you're glued to your screen all day, whether it's your computer, whether it's your phone, you may have something called dry eyes. And all this screen time that we're getting right now, because we're all having to work from home a lot more, we're having to use computers a lot more, may have actually brought you here without you even knowing. So in this week's video, I prepared 10 top tips for treating dry eyes. We're going to be looking at why we get dry eyes. We're going to be looking at all the tips and tricks. And most importantly, we're going to be looking at when you should seek medical attention for your dry eyes. So what we're waiting for, let's begin. So first of all, let's begin with dry eyes. What are they? Well, they're very individualized in terms of symptoms. You may experience different symptoms that I experience, but generally speaking, the symptoms of dry eye include sore eyes, they might be red, they might feel tired, they might be more watery than usual, they might feel a bit sandy or gritty, like you've got a bit of sand in your eyes. These are all the kinds of symptoms that you might experience with dry eyes, but like I said, it's all pretty individualized in terms of what you might feel and what I might feel. So the best thing I will do is leave a full description in the description below of dry eyes, what to look out for. So if you want more information on that, please click the description below. Now, let's flick onto the tips. Okay, so let's begin with tip number 1. Probably the most important thing that anyone can do is to take screen breaks. Now this is really important, and the best way to do it is what we call the 20-20-20 rule. So it's really simple. Every 20 minutes, let's say you've been on the computer, you're gonna take a 20-second break, and you're gonna look at something 20 feet away, which is about 6 meters. And the reason for this is we have something called ciliary muscles in our eyes, and these muscles are contracting really hard to help you focus. So when you're using a computer, when you're looking at the screen, these muscles are contracting, so they're gonna get tired, so they need a break to relax. So you're gonna do the 20-20-20 rule, so every 20 minutes, take a 20-second break and look at something 20 feet away from you, and it's gonna make a massive change and a massive impact. Now, whilst we're on the topic of screen time, another thing that I want to mention to you is your blink rate. Now, when you're on your computer or on your phone for a long time, your blink rate starts to reduce. So on average, we blink about 20 times per minute. Notice the magic number is 20, okay? But when you've been on your phone or on your computer for a long time, that blink rate starts to reduce, sometimes up to about 5 blinks per minute. And this is really bad for dry eyes, because when you're not blinking enough, that tear film that, when you're blinking is going over your eyes, when your eyes are open for longer, so you're doing 5 blinks a minute, it's going to give it more time to evaporate from your eyes, and it's going to make them feel more dry. Now, on top of this, another question I want to ask you is, are you closing your eyes fully when you blink? Now, this is an actual thing. Some people don't realize that when they're blinking normally, sometimes they're not closing their eyes fully. Now, the reason this is so important is when you close your eyes fully, the glands around your eyelids, release an oil, and that oil secretion sits on top of that tear film and helps to stop it from evaporating. So make sure that you're blinking fully, first of all, and second of all, another quick tip that you can do is every couple of minutes or so after a while of working, you can close your eyes fully for about a minute, and this is again going to help with that oil production and that oil release. Okay, so moving on to tip number 2. So we're staying on screens, we're staying on your computer setup. So I want to talk about, first of all, what's your setup like at home or at work? Is your screen an arm's length away? That's what you should be aiming for. If it's too close, you're going to be overusing those muscles, and your eyes are going to feel more tired, and eventually you're going to get more dry because you're overusing those muscles that we spoke about to help you focus on things. And secondly, where is your screen placed? Is it placed directly under your windows, in facing your window? So you're going to be getting lots of glare, because again, this isn't going to be helping. So think about placement as well. And another pro tip that I want to talk to you about whilst I've got you here and we're talking about screens is the height of your screen. Look, the top of your screen should be in line with your eyes. The reason for this is because you're then looking slightly down to look at your screen, and this is really important because it's going to help that when you blink, your eyes shut properly and that oil production, that oil layer is done properly. So it's really going to help with that. So do think about it, make sure that you adjust the height properly. Okay, so moving on to tip number 3. It's all about larger text size. Small text size, larger text size, okay? And the reason I'm talking about this is all about those ciliary muscles that we spoke about earlier, the ones that help you focus, the ones that contract and help you focus. Now, if you're looking at small text for a long time, those muscles are going to get tired and your eye is going to feel tired a lot sooner. So a quick tip that you can do that will really help is to try and make your font size bigger or to zoom in, and that's really going to help keep those eyes nice and refreshed for longer. And just another quick pro tip, make sure that the device that you're using, whether it's your laptop or your phone, is the same brightness as the surrounding area. Look, if you're using your phone, let's say for example, in a dark room and it's super bright, it's again going to put loads of strain on your eyes and all those muscles that we spoke about, and it's going to make those eyes tired, more tired than they should be. So moving on to tip number 4, let's talk about environment. This is something that not a lot of people talk about when it comes to dry eyes, but it's super important. So imagine this. You're at home all day, you've got the central heating on, the house is warm, but after a while, the humidity in the house is going to drop. Therefore meaning that your eyes are going to feel more dry because your eyes are going to evaporate more, and like we spoke about earlier, it's going to make them feel more dry. So you've got a few options really. Option 1, which is the easiest option, which means you don't have to buy anything, is you can open some windows. If you open the windows, it allows more humidity in, and this is going to help with the dry eyes. However, I do understand that if you're paying money to heat up the house and you're opening windows and it's freezing outside, you don't want to do that. So another option would be to purchase a humidifier. You can buy these online, and it's going to help to increase the humidity in the room. However, if you are an asthmatic or if you have COPD or any lung conditions, it is advisable to speak to your healthcare professional first and check if they're okay with you to get that. Now that we're done with winter, let's talk about summer. In the summer, you've probably got fans on, you've probably got the air conditioning on. So what you don't want to do is stay in front of that high velocity air. That airstream, again, is going to dry out those eyes. So don't sit in front of the air conditioning or a fan. Try and keep them away from you, don't point them to you, and again, this is going to help reduce the evaporation from the eye and help with the dry eyes. So now that we spoke about winter and summer, let's talk about outdoors. When you go outdoors, if you're somewhere with very high wind, if you live somewhere that's always windy all the time, or you like to run or you like to cycle, which means the wind is always going to blow in your eyes, it would be worth investing in some sunglasses or some clear glasses to wear over your eyes to protect them, to reduce that evaporation. I always usually wear sunglasses or clear ones when I'm running. If you've been on my channel before, you'll know I'm a very keen runner, but I do get dry eyes when I'm running as well. So I whack on those glasses, I whack on those sunglasses, and it gives me that protection. Now tip number 5 is the easiest one yet, and that is for you to drink water. That's because dehydration can cause dry eyes. You see, when your eyes are open, you are constantly producing a water liquid known as tears, and you're blinking on autopilot to spread that liquid over your eyes. Now throughout the day, this water is slowly evaporating from your eye surface, so you need to regularly replace that lost water by drinking more fluids. So you want to aim for 6 to 8 glasses of fluids per day, whether it's a cup of tea, whether it's juice, or good old plain still or sparkling water. Okay, so moving on to tip number 6. You might have seen this one coming. Now we're going to talk about eye drops and eye ointments. Look, there's many different types of eye drops and eye ointments for dry eyes. So the best advice I can give you first of all is to speak to your healthcare professional to see what they recommend you to have, and also to make sure that you're safe and suitable to use it. Now, for example, there's some eye drops which contain humectants, which basically help like the oil did, how we said, and it stops the tears from evaporating. So that's what they do. But then there's other eye drops as well that contain artificial tears. So just like your tears, they're just artificial ones that help with the dry eyes again. Then we have eye ointments. Now eye ointments are a lot more thick, they're a lot more greasy, and it can sometimes blur your vision as well. So usually eye ointments, we tend to say to patients to use them at night time and not during the day. So it's usually drops during the day, eye ointments during the night. Now, I am going to leave loads more information about different eye drops and eye ointments in the description below, but if you are interested in purchasing any, please do speak to your healthcare professional first, just to make sure that they can check that you're safe and suitable to use it. Also, certain medical conditions, certain patients who have had eye surgery or have any eye problems, they will know which eye drops they can and can't use. So if you are one of them sort of patients, please do again speak to your healthcare professional about it before purchasing any eye drops or eye ointments. Also, I have made a video previously about how to use an eye drop properly and how to use eye ointments properly. This is probably the most critical, super important thing when you're wanting to use an eye drop or eye ointment for dry eyes, because if you're not using it properly, you're not going to get all the benefits out of it. So if you are interested in using one and you've spoke to your healthcare professional and they've recommended you to use a certain eye drop or an eye ointment, watch the videos that I've done on how to use an eye drop or an eye ointment. I'm going to leave it up here, and in the description below. It's going to be super helpful, and it's going to mean that you're not wasting your eye drops or eye ointment because you're using it properly and you're going to get the most out of it. Now moving on to tip number 7. This is all about the oil glands that are around the eyes that help to reduce the evaporation of the tears. We did speak about these a little earlier in this video. However, I do want to discuss slightly about hot compresses. Now hot compresses can help with those glands to help them secrete oil better, and it can also help increase the blood flow around the eye, and it might just help your eyes feel more refreshed and less dry overall. So if you are interested about doing a hot compress and cleaning your eyelids, so eyelid hygiene, doing it properly, I have made a video about this previously. It was all about blepharitis, that video, but I do teach in the video how to clean the eyelids and how to do a hot compress properly. So if you are interested in that video, I will leave a link to it up here and in the description below, so feel free to check it out. Moving on to tip number 8. Look, if you're someone who drinks alcohol, then you need to try and reduce your alcohol consumption or stop it altogether, because if the dry eyes are causing you to go mad, this could be one of the reasons for it. So allow me to explain. When you drink alcohol, your body uses a lot of water to excrete the alcohol from your kidneys, and this can cause dehydration, and this can cause why you feel tired after you drink alcohol, and it can also cause the dry eyes. And another point to discuss is smoking. If you're someone who smokes, you need to try your best to quit. Again, this smoke can irritate the eyes and cause the dry eye as well. Never mind all the other health problems and complications that smoking can cause, all the different types of cancers, all the health problems. So this is another reason why you should really quit smoking. And I know it's easier said than done. I have done a video previously about helping you quit smoking. If you are interested in quitting, I will leave a link to it up here and in the description below. So please remember, you need to try and quit smoking, and if you do drink alcohol, try and either stop or reduce your alcohol intake and see if there's any difference. I will leave more information on both of these in the description below for you to find more information on, to check exactly how much alcohol you're having and whether it's in the healthy recommended amount or not. Now let's move to tip number 9. This is reserved for those who wear contact lenses. If you're someone who wears contact lenses and you don't need to be wearing them, so let's say for example if you're at home and you can wear your glasses, or if you're somewhere that you can wear your glasses, try and take them out more often and wear glasses, if you can of course. Because the reason I'm telling you this is when you wear contact lenses, that oily layer that we've been speaking about that helps to prevent that evaporation of your natural tears and to help you keep your eyes more moisturized and less dry, that oily layer is thinned when you wear contact lenses. It doesn't work properly, which means that you're going to evaporate more. So the tears are going to evaporate more and your eyes are going to feel more dry. So if you can, whenever you can, try and take your contact lenses out and wear glasses instead, and you should see some real improvement by doing this. And just as a side note, if you do wear contact lenses and you are interested in using an eye drop or an eye ointment, you definitely need to tell your healthcare professional that you wear contact lenses, because certain eye drops and ointments cannot be used with contact lenses because they contain certain preservatives or excipients which damage those contact lenses. So please do speak to your healthcare professional about when you want to buy eye drops. If you are interested in them, let them know that you wear contact lenses so they can recommend the preservative-free ones and make sure that them ones are suitable to be used with contact lenses. And for tip number 10, I want to talk about sleep. Sleep is often overlooked when it comes to dry eyes, so make sure you're getting at least 8 hours of sleep every single night so your eyes can rest and recover. Some people might sleep with their eyelids slightly open and their eyes get really dry. If that's the case, you need to speak to your healthcare professional about this, as treatment options are available. Now, if you've tried all of these tips and you've still got dry eye, or you have some other symptoms as well, then it's super important that you do speak to your healthcare professional for advice on this. Also, if you do have any of the following symptoms, again, you need to speak to your healthcare professional as soon as possible. So for example, blurred vision, or any change in your vision, or any pain in or around your eye, these are all factors and symptoms that you should go seek medical attention for immediately. And sometimes certain medication can actually cause dry eyes or just general dryness, okay? That is a side effect of certain medicines. So the best advice that I'd give you is to always speak to your pharmacist about your medicines as well, as it could actually be causing you dry eyes, but this is no reason for you to stop any medication before speaking to a healthcare professional. That is the most important thing, so please don't just stop your medication that you've been prescribed. First, speak to your healthcare professional and check if it actually is a cause, because it might not be. And that's that's a wrap for this week's video. I really hope you found this information helpful. You are now a dry eye pro. You now know all about why we get dry eyes. You now know all about how to treat dry eyes. You now know all about the different lifestyle advice and factors that you can do to help with dry eyes and help your eyes feel less tired. And also, you know when to seek medical attention. So you're a bit of a dry eye pro now. So tell your friends, tell your family, tell your loved ones, because you now know everything there is to know about the dry eyes. I really hope you found this information helpful. Always remember that you're awesome, and I will see you next week. Hey guys, thanks for watching this week's video. Make sure to click that like, follow, or subscribe button now to stay up to date with new weekly videos.